I'm a pharmacist, and I'm going to demonstrate on how to use a Lantus Solostar pen. You want to store your pen in the refrigerator unopened. It can be stored up to the expiration date, or you can store it at room temperature for up to 28 days. Once you use your pen, it should be kept at room temperature and discarded after 28 days of first use. The pen consists of a pen cap, a reservoir which holds your insulin, a place to screw on your needle, and your dose counter. Your dose counter can be moved up or down, but it can't be moved beyond 80 units. If you inject more than 80 units a day, you have to do 2 injections and make sure you change off the needle. You can't use more units than are left in the pen. So if you only have 10 units left in the pen, that's the most units you would be able to inject from the pen. You want to make sure that the insulin is clear, not cloudy, and does not have any particles in it. If it has any particles, you want to make sure you get rid of the pen. You can call the company to see if they would replace the pen for you, or return it to your local pharmacist to see if they can help you replace the pen. To use the pen, you want to make sure that you wash your hands with soap and water, which I've previously done, and then you want to clean the injection site with alcohol. You can inject the insulin on your upper arm, your thighs, or your abdomen. If you use your abdomen to inject the insulin, make sure you stay 2 inches away from the navel. You want to remove the cap from the pen and place the pen needle on. Various brands work with this pen. Today I'm using the BD brand. You want to pull off the protective seal and screw the needle on. You can take off the outer pen needle cap. You want to save this for later. And there's an inner pen needle cap that you take off. And you can throw this away. You want to do a test dose first. You're going to dial it up to 2 units. And then you're going to push in the button and make sure insulin comes out. Once you see this, you're ready to use your pen. You dial up your dose. So if I'm going to inject 10 units, I'll dial it up to 10. And now I'm ready to inject the dose. You want to go in at a 90-degree angle. And you want to push the button in and hold it for 10 seconds. Once you're done, you put the cap back on the needle and you screw it off and discard it in a sharp container. Put the cap back on and store the pen in a safe place. There are advantages to the pen and disadvantages. The main advantages to the pen is the fact that it's very convenient, it's easier to carry around than vial insulin and syringes. The dose is easier to read than the syringes, and it requires less dexterity to use. The main disadvantage to the pen is that it costs more than the vial insulin. It's approximately $200 for 5 pens if you're paying cash. Insurance and some do cover, some don't. Some prefer the vial over the pen. It just depends. You can obtain the pen from your local pharmacy with a prescription from your doctor. Thank you, and I hope you learned a lot.